How's it going, everyone? This is Kyle with Dirt Bike Channel. This is the Dirt Bike Channel podcast. You made it. Thank you so much for stopping by here. We've got a pretty awesome podcast coming for you today. I've got to apologize for not putting out these podcasts regularly during the summer months. It's just so tough for me to get out content because I've got so many other things going on. But once we get into the fall here, I'll have a little bit more time and I should be able to get these podcasts out in a little bit more of a regular schedule. So today should be pretty sweet. We've got Dr. Jacob Kapp. He's coming on with us. He is a doctor of physical therapy. He reached out to me a couple weeks ago and he had some interesting ideas for a podcast. And the reason why I think it's pretty cool is because he's a dirt biker as well. I love hearing from, all the different experts out there that are in the kind of dirt bike channel community. And I'm sort of selfish. I take these podcasts, a lot of them are the ones that kind of like suit my flavor for that time. I'm really selfish. Like, hey, I'm interested in this topic right now, so I think I'll talk to this individual. So hopefully you guys get some benefit out of that. And I'm going to get Dr. Jacob Kapp on the phone right now, and let's jump right into this. Hey, Jacob, are you there? Can you hear me?
Yes, sir. I'm here.
Perfect. So this is Jacob Kapp. Now, Jacob, you are a doctor of physical therapy. Is that correct?
Yes, that's correct.
That is awesome. And you're also a dirt biker, right?
I am.
Well, this should be pretty cool because when you reached out to me a little while ago, some interesting things have happened to me in the last couple of weeks because I was kind of in my pretty good dirt bike shape for a while. And then I took a little bit of time off because I was doing some family things. And then I jumped right back on my dirt bike. It was almost like a 3-week break. And man, I felt like a 90-year-old man after that one ride on getting back on my dirt bike after a little while. And then you reached out to me and just one thing has led to another. And I think it's a perfect timing for me to talk about how we're treating our bodies and different things that we can do from a therapy perspective or from a therapist perspective, like your case. And I think a lot of people would be interested in this topic. So thanks for coming on with us.
Yeah, I'm glad to be here.
So tell us a little bit about yourself. Tell us a little bit about your practice, maybe tell us a little bit about your dirt bike background, and so we can kind of get to know you just a little bit.
Yeah. So I'm a physical therapy. I graduated from Campbell University. That's a school in North Carolina. But I'm actually from Utah, so it's hard to move away from the mountains. Couldn't stay away for long. So yeah, we're back now. I'm kind of involved in a lot of different things. So I work my kind of 9 to 5. I work for an outpatient orthopedic clinic in Roy, Utah. We specialize in orthopedics and sports injuries. And then on the side, I work with a company called Extremis Performance. They're based out of Dallas, Texas. One of my friends from school is the president of that company. And we work with law enforcement and special operations to do both physical therapy services and strength and conditioning. And then I also have my own company called Mountainstrongspine and Performance. And I specialize in treating back pain, and I do home health style visits, one-on-one visits with that under that company. So I have a lot of things going on, but overall I just enjoy treating people and helping people feel better and stronger. And then dirt biking, my dirt biking days started when I was a lot younger, elementary school, junior high. I had a buddy up the street that had a couple bikes, and he was an only child, so I'd always go ride with him and just on a little TTR 125. A lot of trail riding with him and his family, and then once we got older, I stopped riding, and my wife and I bought bikes last spring. I got a KTM XCW 150, and my wife rode a Honda CRF 150, and it's been trail riding anywhere from northern Utah, southern Idaho, southern Utah, all over the place, and yeah, we enjoy it. It's a great time.
That's awesome. And I love the fact that you got into it with your wife and you got the right bikes. Those sound like really, really good bikes to kind of get back. I know it wasn't your first bike, but those are fantastic bikes to get back into things. Too many people overlook those types of bikes, and they're fantastic.
Oh, yeah. When I was looking into bikes, originally I thought I wanted a 4-stroke because back in the olden days, 2-strokes seemed to always have problems and you always had to rejet them. And I talked to a bunch of people. I talked to several mechanics, and they talked me into getting a 2-stroke, and I got the KTM, the XCW, and loved it. My wife and I mountain bike a lot as well. And the first thing I noticed on that motorcycle particularly is it really felt like a mountain bike, just kind of an oversized mountain bike. So the riding position and the feel and how light it was was kind of familiar to me from mountain biking. So I really enjoyed that motorcycle.
Yeah, so let's talk a little bit about some of the common aches and pains after riding. And you've seen this throughout your life, and I think the aches and pains start to get more and more as we age. I'm 39, almost 40, and it feels like I still feel like I can do a lot of things, but the one thing that seems to be over the last decade is if I do get sore, it lasts a little bit longer. So what are some of those aches and pains that you see and you see some of your patients have after riding, and maybe what are some of the causes of being sore from your perspective?
Yeah, so some pretty common things are like hip pain, kind of like deep groin pain, neck, the cervical spine feeling stiff, tight, low back. A lot of people complain of their low back feeling just fatigued or achy, sore, stiff. Those are probably the most common that I see. And hips, that's 9 times out of 10, that's probably related to just hip mobility because, most dirt bikes are pretty tall and not everyone is 6.5 feet tall. So getting on and off the bike, it does require good hip mobility. And you think about not just getting on and off the bike, but the bike tips over, or you have to get off quick. So there's a lot of quick movements that will require good mobility in your hips. And if your hips aren't mobile, that just puts stress on other areas. For example, if you don't have mobility in your hips, you've got to find it somewhere else. So that just means your spine's got to bend more, or something else, somewhere else in your body has to move more because you lack the mobility in the hips. Neck, a lot of the problems in the neck is generally related to mobility as well, and then just the ability of the muscles in the neck to maintain good posture, good form over a long period of time. Because while you're riding, you've got a helmet on. Nice helmets are light, but still over a long period of time, that's a considerable amount of weight on your head. And then you've got to be able to rotate and look over and see how your buddy behind you is doing. Look and scan for obstacles. Your neck is just constantly moving. So the better mobility that you have there, it's just less strain on both the joints and the muscles in the neck. And then, so we talked about the neck, we talked about, and the back, like your low back. Most of that is going to be related to strength. So the muscles in your back, in our body, we have different types of muscles. Type 1, type 2. Type 1 is generally more kind of endurance-based muscles. So muscles that support your spine, they're generally more type 1. So their job is to be able to contract or hold position over a long period of time. And so when you're riding a dirt bike, you're rarely are you seated if you're trail riding, right? So you're standing on the bike. You've got to keep your back in alignment. It's got to be able to maintain a good form over a couple hours worth of riding. And if you don't have good strength or stability there, you tend to break down over time, and that can lead to some of those common aches and pains.
Interesting. So when we talked before, you did mention this concept of mobility in your hips. And it wasn't something that I had thought really anything about before, but you bring up some of these different movements that we're doing, one of which is just swinging a leg over the bike. And we also talked about how mobility, if you lack mobility in your hips, then your body has to compensate and put stress on other parts of the body. Before we really talk about that, about, maybe lacking the mobility in your hips, how do we get more mobility in our hips? If you're saying, hey, look, how do you even test how much mobility I have? Are there certain stretches that you might be doing, or how do we get more of this hip mobility?
Yeah, so you can get mobility through stretching, through strengthening as well, and then you can do like joint mobilizations. So those are generally the 3 techniques that physical therapists will use to help improve mobility in patients. And it all depends on what your restriction is. So you can have, we call it soft tissue restrictions, right? So that would be anything that's not bone or not really based in the joint. There can be a joint mobilization restriction. So within the joint itself, the the bones that make up the joint, there could be a restriction inside there. And so if you kind of, that's kind of where PT sometimes can help, is kind of determining, okay, if you do lack mobility, what is the cause of that lack? If you're not seeing a physical therapist and you do want to start stretching, or working on hip mobility, there's plenty of great videos online. If you Google, for example, banded hip mobilization, that'll show you how to use. I'm sure you've seen CrossFitters use those big, thick rubber bands, those big monster bands. Those are great tools to use to help improve hip mobility. And then just your stretching. If stretching is the easiest thing for you to do, and you feel pretty confident stretching your hips, just know that in order for stretching to be effective, it's got to be something you do almost on the daily. If you just stretch a couple minutes here and there once or twice a week, it's not really going to benefit you at all as far as increasing like the ability of your tissues, your muscles, fascia, and all those things to stretch and move. And then going back to your point on kind of how to assess that in yourself, the easiest thing is if you notice that getting on and off the motorcycle, swinging your leg up and over the bike is uncomfortable or causes a feeling of tension inside your hips or kind of inside your groin, or if you feel like it's straining, that's a pretty good indicator right there that you're lacking sufficient mobility in that hip to do that activity or do that movement. And we're not all the same side to side. So you could have, sometimes it might be, I know when I would get on the motorcycle, it's pretty much I always swing my left leg over the bike. I rarely go over with my right first. So that's something to try. Just kind of look at yourself side to side and see if one side, if you do one motion, getting up over the motorcycle, swinging your left leg over first, that feels uncomfortable, try it with the right. If that feels better, there's an easy kind of self-diagnostic that one side of your body is not quite the same as the other. But simplest thing is if a movement that you perform repetitively while riding is uncomfortable every time you do it, that's an indicator that there's probably a mobility restriction there.
You know, that's interesting that you say that, because as you were talking about it, I realized that I almost always lift my right leg over the bike. And if I have to get off the bike really quick, a lot of times it seems like I do it, I get off the bike to the left-hand side. I think that's probably because the kickstand is on that side. But most of the time I'm lifting my right leg to get over the bike. But I think I can do either one. I'm going to have to pay more attention to that to see if I have more mobility on one side than the other. So let's talk a little bit about, because you used, when we were on the phone before a week or so ago, you were talking about proximal, this term proximal, and you were talking about lacking mobility proximally in your hips. And if you have, a lack of mobility there, that your body will start to compensate and put stress on other parts of your body. Can we dive into that a little bit more?
Yeah. So it's kind of this idea of proximal stability before distal mobility. So when you look at the grand scheme of, okay, what's wrong and where, it's always best to start with the trunk and the torso. So, and what's attached directly to that. So if your core, your back, your torso, shoulders, hips, if all of that is stable and strong, it'll affect everything else down the chain. So for example, if your hips have good strength and good stability, then that increases the stability, strength, and the ability of your knees and ankles to move and move well. If your shoulders are strong and stable, that increases the ability of your elbows, wrists to move and move well. So when it comes to where do you start, it's always better to start like exercise and rehab generally. It's always better to start proximally, because if you don't address the foundation, right? So the trunk, if you don't address the foundation, it's kind of hard to really fix everything else. You're kind of just chasing problems at that point. And a lot of aches and pains that come in the extremities, usually pain is a symptom of a problem further up. So if all you ever do is chase the symptoms and never really address the problem, what's causing the problem, you'll never really solve anything. So it's always best to kind of look at, if you're having an ache pain, or an issue, if it's further down the line in your body, always start proximally. So always start with the spine, hips, shoulders, and then address any issues there. And a lot of times that will take care of everything else. Does that answer your question, Kyle?
Yeah, so it just kind of then gives me another question. So I'm just kind of envisioning, the general rider who's maybe having some aches and pains or something like this, and they might come into your practice, or maybe it's somebody that's just playing pickup basketball games or something like this, or whatever, or maybe softball or something, and they come into your office and they say, "Hey, Dr. Cap, I'm experiencing kind of this pain in my low back, or my knee hurts, or my elbow hurts, or my shoulder hurts." How do you go about kind of figuring out what's the best workout or what's the best therapy for each individual? I mean, obviously it's going to be different, but let's look at it from a dirt biker's perspective. If you had a dirt biker come through the door and say, "Hey, my low back is really sore," then what types of things are you going to want to look at with that person?
So let's talk about the back specifically first, just because that's what you ended on. That's kind of my favorite thing to treat. So anytime that someone complains of back pain, whether it's sharp pain, achy pain, and whether or not they really know how it started or how it didn't start, if it kind of came on out of nowhere, it's, as a physical therapist, the first thing we always do is just screen out what's called red flags. So it's making sure that, one, that everything is, like, the patient's not in danger, right? They don't have anything significant going on in the body that needs immediate medical treatment. So PTs, that's the first thing we screen out, is make sure, okay, the patient's safe, they're not going to die, and that exercises or movement-based treatment is what they need. So once we screen the red flags, then we move into what's causing the pain. So if someone comes in with back pain, kind of screening out, okay, so first off, how do they move? How well does that part of their back move? Does it move within the normal ranges that it should? And looking at what's restricting that movement. Is it the joints in the back? Is it muscles? Is it like muscle guarding? Is there a nerve that's causing the issue? And then once we kind of determine what's causing the pain, we also look at, is the pain being caused because there's a problem with the disc? Is there pain just a muscle strain? And all of those, taking all that into account, it kind of determines how we treat it. And then a lot of treatment with back pain generally starts off with just trying to reintroduce normal motion to the spine. What's really common with back pain, whether it's the neck, mid back, or the low back, is your brain starts to think, okay, movement's bad, right? Because you have back pain, you get off the motorcycle, you drive home, you get out of the truck, your back hurts, and for 3 days after that, it still hurts. You probably don't notice, but you start to kind of stiffen up, and you're not moving as much as you did before because that motion hurts. So your brain starts to think, okay, movement's bad, let's stiffen up and not move. And once you've been screened that everything's okay, you don't need a surgery or anything scary like that. You don't need to go to the ER. Movement is how we fix the problem. So finding movements that you can tolerate and building your tolerance to those, and increasing your ability to move your spine over time. And then the second step would be reintroduce load, or the ability of your spine to tolerate some resistance, some load, while under movement or in a static or a position that you don't move. You just load the spine in a non-movement position, and gradually progress the patient back to being able to move and lift and bend and do all the things that they need to without pain. So that's kind of general process of, so if someone came in to me with back pain, how to determine what's causing it, and then just really basic, how do we treat it from there?
Yeah, so I mean, one of the things that it feels like to me is that if I'm constantly moving and doing a lot of different physical activity, I stay pretty limber, and I stay, where I don't get too stiff. It's where I take a break from something for a while, maybe 2 or 3 weeks, and then I just jump right back into it. It seems like that's where I kind of get into a little bit of trouble. Let's talk about maybe some of the different types of physical demands that we put on our bodies, specifically as dirt bike riders, because we're putting our body through a lot of stress, I think, and obviously it depends on the type of riding that you're doing, and maybe motocross would be a certain type of a stress, and maybe hard enduro riding could be another type of stress. But just generally speaking, on your dirt bike, you have some similar, demands that we're putting on the body, regardless of what the discipline is. We're going to need, quite a bit of core strength. We're putting, demands on our spine and our shoulders and ankles and wrists, all of these things. And I think that we're not thinking a ton about this all the time. Can you talk as a doctor, as a physical therapist, what are some of the unique physical demands that you see that we're putting on our bodies when we're riding our dirt bikes? What are some of those demands?
Yeah, so let's start proximally. Let's start with the spine. If you think about your back and your core, and you were to think about common exercises to strengthen those, right? What commonly is thought is like crunches or sit-ups and things like that. But if you go back and think about, okay, when I'm on my dirt bike, I'm on my motorcycle, I'm riding. Generally, the majority of the time, your back is actually in kind of a static or a non-moving position. It's stabilized, right? Your trunk, your torso, back, all of that is really stable while you're riding, because that's what allows you to control the bike. You're not really performing a crunch or a sit-up type movement, while you're riding a motorcycle.
Are you giving me a free pass so I don't have to do any more crunches?
Yeah, sure.
not that I do, but yeah, you make a good point, because like spine, your core, everyone thinks about core. It's like, let's do 1,000 sit-ups, but it's like you're not doing sit-ups on the bike. It's almost
Correct.
like the exact opposite thing that you're doing. You're just holding yourself in one position. It's almost like a plank. So maybe planking would be better off than sit-ups, right?
Exactly. The physical demands on your spine while you're riding it demands spinal stiffness. Right. So it demands the ability of your spine to maintain position and hold that position under the stresses while you're riding. While you're riding, the bike's coming up into you, right? You're going down into the bike over bumps. You're standing up, you're sitting down, you're leaning forward, you're leaning back. All of that requires that your spine be able to take that load over a long period of time. And the spine tolerates load best when it's in a strong, stable position. So finding exercises, exactly like you said, planks, cow-off presses, side planks, where you are holding the spine in a neutral position under load, against the load over time. Those are much better exercises for dirt bikers specifically than doing crunches to increase core stiffness. Because if you think about a crunch, it's going to work your abs, right? Your six-pack.
Yeah, all of our six packs, right?
Right.
Because we all have six packs.
Yeah, it's totally normal. But those muscles, the rectus abdominis, the six-pack muscles, don't attach to your spine. So even those muscles themselves don't really have a direct influence on the spine. There's other muscles that directly attach to the spine that are easier and better loaded with, like planks, side planks, pal-off presses, things like that.
What was that last one you said? It was something press?
Pal-off press. It's where you've seen people use, they have a cable machine, and they'll stand in a stable position, and then both hands will be on the handle of the cable, and they will press forward and pull back. And basically what they're doing there is fighting the cable, rotating their body. So they're keeping their body stable against that lateral pull from the cable.
Okay. Very good, very good. So you talked a little bit about proximal and distal, and proximal is going to be like the bigger. This sounds so dumb because I'm not a physical therapist guy, but proximal would be your core parts, like your back and your spine and your hips, and distal would be more things like your neck and your shoulders. Have I got that right? And your like wrists and ankles, or are those the distal things?
Yeah, definitely ankles, knees, wrist, elbow, neck. That could probably fall into both categories. I'd probably still classify them there as a proximal. But yeah.
Very good.
You're correct.
Very good. So then let's maybe talk a little bit about muscular power and strength and endurance and how these things kind of fit into a ride and what maybe some of these training regimens should be. Can we kind of roll into that side of things?
Yeah. So,
oh, and one other thing too, before you jump into that, I've been writing notes down as you talked. You were talking about type 1 muscles and type 2 muscles. You said type 1 muscle was like your back and your spine. Give me another example of type 1 muscle and then a couple examples of type 2 muscles here.
So type 1 is they're just called endurance fibers. And then type 2 are your fast twitch. Okay. So type 1, slow twitch, type 2, fast twitch. So fast twitch muscles generally are like your bigger power driver muscles. So if you think of even body types, people genetically will have either more type 1s or more type 2s. So if you look at a marathon runner, they're lean and they can go for a long time. Their body has more type 1 or slow twitch fibers. You look at a sprinter, generally they are jacked. They have quite large quads, hamstrings, glutes. Their muscles are really, really good at generating a lot of power really quickly. When we are riding dirt bikes, there are different demands. Like all of us have type 1 and type 2 fibers. And so if you're riding dirt bikes, there are different demands, different activities while you're riding that require either muscle power, muscle strength, muscular endurance. Things that require power, you think of like doing something quick, right? So anytime you're using to grab the seat and lift the back end of the bike up quick or spin it around, that requires a lot of quick movement, and you've got to be able to move that load really quickly. That requires a lot of power. Endurance is, we have muscular endurance, cardiovascular. Right now we're kind of talking more muscular endurance. So that's the ability of the muscles in your back and shoulders, hips to be able to maintain stability on the motorcycle over a long period of time. And then strength is just how much force can you generate, right? So muscle strength and power are very closely related. Strength, I think it's just how much force can you produce? How much force can those muscles in your body produce? And so that's how power, strength, and endurance, that's kind of how they all relate in dirt biking. And that's why your exercise programming should be specific to whatever the activity that you want to perform in, right? So if you're a marathon runner, your exercise programming is going to probably revolve around more of an muscular endurance-based program. If you are a sprinter, it's going to revolve around more of a power-based exercise program. Dirt biking, it's kind of a mixed bag, right? It's different depending on what kind of riding you do. If you're a motocrosser versus a trail rider, we're probably more talking to trail guys on this podcast. So you kind of need the mixed bag of tricks when you're out there on the trails. You've got to be able to go for hours at a time, and you've got to be able to maintain good stability in your back, approximately, as we've talked about. But you've also got to be able to generate power if you've got to lift that bike up over a log or move quickly, right? Or move the bike quickly. If one of your buddies falls over, the bike lands on him. You got to be able to get that bike up and off of him really quick. So as a dirt biker, you kind of have to determine, okay, most of my riding, this generally we go for long rides. So then you probably should program a little bit more endurance. If you do quick short rides that are really aggressive where you're getting up and over big rocks and stumps, you probably need to program in more power and strength. So just making sure that your programming, your exercising, your training is specific to your needs.
Yeah, so that's really good. I was actually getting back from a ride this last week, and I was talking to a couple of my buddies on the way home, and I feel like there's really no substitute for the seat time on the bike. It's very difficult to it's very difficult to replicate the types of demands that you're going to be put on, like in the gym. And so I do think that the time on the bike is going to be critical. If you want to be able to ride for 3 hours, probably the best way to do that is to work up to a 3-hour ride for 1 hour, for a few times, then ride for 2 hours, then ride for 3 hours, and so on and so forth. I think that's going to play a bigger part in this than anything. But then the other side of it is developing some of these core, these strength and power and endurance things into our workouts and things. So how much do you think it's going to benefit? I guess one question I have for you is, do you think that every dirt bike rider should have a gym membership or have certain, exercises that they can do at home? How important do you think these things are? And if you could say, well, everyone should have a gym membership, or should everyone just have, a few different, exercises that they can do in their home? Where do you fit on that stance, or where do you come in on that?
Yeah. So I want to talk about first kind of that point that you brought up of, time in the saddle. When it comes to whatever activity you do, whether that's a sprinter, marathoner, or a dirt biker, the only true way you're going to get truly better at that activity is by doing that activity, right? And
I love
progressing your tolerance to it. But if you don't train as well, if you don't exercise and put your body under progressive overload, you're going to kind of plane out. There's only so much that if a marathoner just runs, they've actually been shown to have higher risks for injuries, and their bodies kind of wear out faster. Versus marathoners that strength train, that instead of just running miles and miles and miles, they also have times where they strength train. They actually perform much better. So that's the same with dirt bikers. So I don't feel strongly that you need a gym membership, especially during Corona, right? A lot of gyms were closed for a while, or restrict the number of people. So I think there's a lot that you can do at home. And there's a lot of things that you can do with very minimal equipment. And so I do think it's important to not just ride the bike. Yes, I agree that time in the saddle is extremely important. And I agree with you that you should build your tolerance over time. You shouldn't just go out and do a 5-hour ride through the mountains without having done some shorter rides before that. Otherwise, you're gonna pay for it later. But you do need to, I think, several times a week, be exercising to progressively to do that progressive overload, right? So that your body is continuing to develop and become stronger, and so you can develop more muscular strength, power, and endurance, all these things. And you won't get that by just riding a motorcycle. You've got to strength train as well. So, like I said, I don't think you need a gym membership. There's plenty of things you can do at home. That's one thing that I do as part of my business. It's not just physical therapy. I also offer like training programs for people. So it's not all, you don't always just need rehab. Sometimes it's all you need is just good exercise. And so, yes, it's extremely important to exercise regularly as well.
What was this? You used the term a couple times, progressive overload. Can you talk to me about what you mean by that?
Yeah. So if you think about your day-to-day activities, right? So most people are generally pretty active. They've got, they go to work, they have housework they mow the lawn, they do all those things. And yes, that is activity. But if you do all of those things pretty regularly, so every week you mow the lawn, every week you push the trash cans out, every week all those things that you do regularly, they don't really cause much of a demand on your body. Your body gets kind of used to that amount of load or stress or strain that you put on it. And over time, it's kind of just, your body that's its regular functioning activity level. So in order to actually get stronger, you have to increase the load or the strain on your body. And when I say progressive overload over time, when it comes to exercising, so whether it's rehab or strength training, I always generally, with my patients, I find a load that they can tolerate that doesn't cause pain, right? If I'm rehabbing an injury, find a load they can tolerate, doesn't cause pain, and then gradually I progress that load so that they can build strength over time. And it's the exact same with strength training. If you think about squatting, you don't just squat with the bar your whole life. You guys, after 2 weeks of squatting with just the bar, that would get pretty easy and really wouldn't benefit you much. So, you squat with the bar to start out, then you have, 20 pounds on each side. And you do that until that becomes easy. And you're just progressively loading your body over time so that the muscles will break down and come back stronger.
Cool. So let's talk about some of those exercises. You were just talking about squatting. And I know that one of the things that we talked about a couple of weeks ago was how you're big on having exercises that are really similar to what you're going to be doing, in that specific discipline, whether it's basketball or baseball or whatever, in this case with riding dirt bikes. So what are some of the common exercises that would be good for a lot of the listeners to start thinking about in order to, build some of these things that we're talking about?
Yeah. Some of my favorite exercises, it's just, meat and potatoes. Let's go back to the basics. Exercises don't have to be fancy. They don't require a lot of equipment. And you don't need to do a lot of different exercises to get benefit. So I think some just really good common exercises are the squat, deadlift, planks, whether that's on your side or prone, kind of, so your face is facing the floor. And then probably a little less common, things like hip thrusters. And I'm sure you've all seen those machines at the gym where you kind of lay over it. So you've got a pad across your hips and then you extend your back up and back down. That's called a reverse hyper. Those are probably some really, really basic, really, really good exercises. So the squat, deadlift, hip thrusters, reverse hyper, and then planks, whether that's side planks or planking kind of on your forearms or on your hands. Those are great exercises to build strength, power, and then that core stiffness and stability that we've talked about.
So if somebody's going to do squats at home, like for me, I don't have like a squat rack or anything like that. How do you recommend somebody starts into doing squats? And what are some of the things that you need to watch out for? One of the things I'm worried about is just injuring my knees or hurting my knees by maybe having the wrong form. So is it like kettlebells that you could get, or what would you suggest?
Yeah, easy enough. It would just be starting with body weight. So a squat, I would start with body weight. And then if you don't have weights available to you, lifting, most of us have things in our garage that weigh anywhere from, 10 to 50 pounds. And whatever you've got, I would just hold it close to your chest. And once you feel really good with body weight squats, you feel like your form is good. And we can talk about form in just a second, but progress from a body weight squat to holding weights, whether that is kettlebells. I love kettlebells. I know not everyone has those, and those can be a little expensive. But think about, if you've got a bag of mulch in your garage or dog food, all these things that most of us have laying around that are really cheap, really easy ways to add some load to your body. And so that'd be a good way to start with squats. Deadlifting, most people don't usually do those, and that is a little bit more, that requires a little bit more of form and technique to do well. So I would either consult like a PT or a personal trainer, or YouTube some good videos and watch a variety and just see what the movement patterns are for these exercises, deadlifts particularly. And then the key is going to be building up your tolerance over time. So I would never suggest to someone that's never done a deadlift, hey, pick up a bar with 150 pounds on it. I do deadlifts all the time with my patients, and we start out with just body weight.
Yeah.
We'll just go through the movement with body weight. And then kind of jumping back to your question on form for the squat, biggest things to look out for are when you squat down, making sure that your knees don't cave in or flare out, right? You want your feet, and I generally start people off in a squat with no shoes on so that you can really feel the ground with your feet. And you should feel like when you squat down and stand up that you are able to keep a solid, even amount of weight through the heel and the ball of your feet. That you shouldn't feel like your toes are lifting up or your heels are lifting up. And then watch, like I said, minutes, seconds before, is just watch your knees, making sure that you're controlling your knees so that they don't fall together or kind of flare out or fall outwards while you descend or ascend out of the squat. And if you can do those things, so keep the knees stable, keep the feet firm and planted, and then progressively increase your load over time, squats are great for your knees. They actually, for people that have like knee pain, if it's there's lots of different kinds of knee pain, but for example, squatting, if someone has knee pain that's underneath the patella, like it's pain that's caused from the compression of the patella or the kneecap on the femur or on the tibia, the two bones in your leg. If you squat, that actually spreads the force out to a greater degree across that joint where the patella meets the femur in your knee. And so that spreads that force out more. So a squat is actually less pain-provoking for that type of knee pain than, say, for example, sitting on the edge of a table and extending your leg out like with weight on it. So a common thing at gyms is those leg extension machines where they stack all the weight on it, right? You put your ankles behind the pad and then kick your legs forward. Something like that actually puts more, it doesn't spread the force out as much underneath the patella or the kneecap as would a squat. So it's hard to say, like, if you have knee pain, do these exercises, right? Because knee pain can be caused by many different things. So that's kind of where PT can really be beneficial is having a PT evaluate, okay, what's the source of your knee pain, and then prescribing exercise that, one, doesn't irritate it, and two, will help you get better faster.
Yeah. So one final question on the squat then. How far down do you go? Do you want to make sure that you don't go more than 90 degrees on the knees, or what do you look for there?
Yeah. So I would video yourself from the side when you squat, and everyone's anatomy in the hips is just a little bit different. So if you're doing a body weight squat, I'm not too concerned about how low you go. I would go as low as you feel like is comfortable for you. If you're loading it with a barbell, for example, that's where you need to just be a little bit more cautious with your form. So if you video yourself and you watch yourself kind of descend into the squat, if you notice that as you get to the bottom, your pelvis or your hips kind of round forward, or tip back so that your low back is rounding. If you notice that is happening over time, if you were to do that with a lot of load on your back, that just puts a lot of strain on the spine. So I would just video yourself and watch and see how far down you can go with keeping your back really nice and straight, nice and level. Most people, that's probably going to be somewhere around 90 degrees. And so that's a really easy self-evaluation tool. Just watch and see, okay, when I squat down, I went to 90 and my back stayed nice and flat. My back and hips stayed in alignment, and there wasn't any rounding of kind of around my low back and top of my hips. But then I went past 90 and my hips rounded and my butt kind of winked. Then that's just a good indicator that you don't quite have enough mobility yet to go that low, especially under load. Okay. And then over time, I mentioned earlier, kind of at the beginning, that strength exercises actually do stretch. So over time, if you squat to 90, eventually you're going to notice that you'll be able to go lower with better mobility, because that load and that movement, that in and of itself will give you better mobility.
So we've talked a little bit about, all these different things to kind of maybe develop our own little training program. What are some of the benefits that you can see as a physical trainer, as a physical therapist, that you would get if somebody went to an actual PT and help to help them develop that program? I feel like for me, I could watch 100 YouTube videos and I could probably get a lot of different ideas, and even a different, one trainer would give me different ideas than another. But from your perspective, what is the benefit of going to like a physical therapist to have them help you develop a training program?
Yeah, that's an awesome question. So I would say the main benefit is going to be injury assessment. So if someone has had chronic injuries in the past, the PT can help assess, okay, what likely was the cause of those injuries and how do we prevent that from happening? And then someone that's been relatively healthy and really hasn't had issues, the PT can assess, okay, so let's watch them move and let's see if there are some movement faults or movement dysfunctions that over time could cause problems, especially if those movements were loaded with it, and especially with exercises, right? So if you lack mobility, if you lack mobility in your hips or spine, or strength, or the ability to maintain stabilization in your spine with certain exercises, the PT can kind of point that out and guide you in the direction as to how to program safely and move safely so that you don't develop a problem later on. A lot of people think, well, I'm healthy, I don't need any help, but most of us have some sort of issue somewhere, some compensation somewhere that we make with our bodies, and we don't really recognize it. And if we were to continue in that compensation and add load to it with regular exercise, that has the potential to cause injury. So PTs are great to help prevent injuries, and then for people that have had common issues in the past, help address not just the issue, but how to kind of elude or evade, not have that issue in the future.
Perfect. I want to maybe transition to just something like warming up before a ride. I can think back to different people that I've ridden with, and some people have a regimen that they do. I really don't. I can think of one guy that would kind of do jumping jacks before. He would kind of get all geared up, get his helmet on, get his boots on, and then he would, do 25 jumping jacks or something like this. What do you think about warming up before a dirt bike ride, and what might that look like?
I think warming up is a great idea. Kind of think of it like priming the pump. You're priming the muscles for action. So especially because most of the time when we go riding, Utah, we're a little bit lucky because a lot of trails are pretty close to where most of us live, but that's not always true for everyone. And especially if you're going on rides that require long hours of driving, the difference in activity from sitting in your truck and pushing the gas and brake is a lot different than hopping on the motorcycle and going up over terrain. So I think warming up is a great thing to do. And I think your warm-ups can be something really simple, and generally just try and mimic whatever the activity you're going to be doing. So dirt biking, you're standing on the bike, your legs are coming up into you, your hips are dropping down as you go up and over terrain. So squats or just body weight squats are great warm-up. I mean, your friend that did the jumping jacks, I think that's great. Just doing something that doesn't really cause fatigue in the muscles, but is enough to just get some blood flow and kind of wake them up. You could think of it that way. Those are usually great warm-ups. If you do have like a hip mobility issue or a neck mobility issue, your warm-up you can use your warm-up to address those issues. So whether you're doing stretching for your hips or for your neck, or mobilization, banded mobilizations for your hip, those are really easy things that you could do just in a few minutes before you hop on the motorcycle to help you feel better and be able to last longer with less pain and problems.
So we got to get those muscles turned on. I see, like in I'm a motocross and supercross fan. I see a lot of those factory riders up on maybe like a pedal bike, like a stationary bike or something like that. So it's just kind of interesting. I'm gonna have to do some more squats when I get out there and get ready to go. I always, part of me makes me, one of the reasons why I feel like I haven't done it is I know I'm going to put my body through hell, and we're going to go and I'm going to burn 25 million calories and whatever. And I'm like, I don't want to burn any calories before I even get started. I don't want to wear myself out. Obviously, if I did, 5 or 10 squats, it wouldn't. How many, so let's say squats are a decent warm up thing, and you're doing body squats at home, or you're doing maybe some, squats with weight. Then how many squats would you say would be a decent, because you're just going to be out there with nothing but your body. How many would you recommend people do? 10, 20, 30? What are you talking about?
Yeah, so if you're just using a squat for a warm-up, I would do anywhere from like 10 to 12, and I would do that 2 to 3 times, in succession. After you've done 10 to 12, rest for 30 seconds or so, do another set of 10 to 12, rest 30 seconds, another set of 10 to 12, and call it good.
Okay.
But, let's go back to, we talked a lot about like spinal stiffness and stability. So one, you've got to have, your legs are kind of one of your primary force absorbers, right, on the motorcycle, and then the spine. So I would mix in like a plank. So I would do your squats, and then I would quickly do like a plank for, anywhere from 15 to 30 seconds, right? And just do one or two of those and call it good. That's, as far as a warm up goes, that's probably plenty.
I'm making some notes here. So squats and a couple planks. Okay. And those planks wouldn't even have to be that long. Normally, well, I guess it differs for every person, but if you're going, 15, 20, 30 seconds on a plank to warm up, that'd probably be good.
Oh yeah, definitely.
Okay, 15 to 30 seconds. Fantastic. I'm so selfish. Like a lot of times when I do these podcasts, it's really just because of my own selfishness. And I'm like, here's somebody I'd love to learn from. And hopefully the listeners can get some benefit out of it too. So that's the warm up. What about a cool down? I remember, and we can talk about stretching too. I remember I was riding with Graham Jarvis a couple years back, and I asked him about like warming up or stretching and things like this, and he's like, no, I don't stretch before I go. I stretch after my my rides or something like this. Is stretching a good part of a cool down? And can we talk about maybe the benefits of a cool down at the end of your ride, and also what that could entail?
Yeah, I think a cool down is a great thing to do at the end of the ride. Our bodies recover better with more of like an active recovery. So a lot of people think, oh, I'm sore, I'm just going to throw ice on whatever's sore. That can help. But research has kind of shown it doesn't really, it's more of a mental thing than an actual physiological change. So doing some sort of cool down when you're done will help your muscles recover faster and feel better, especially if you're going to get off the bike and go sit in the truck again for an hour plus. So I think stretching is a really good way to cool down. It calms you down. Right. It's a way it doesn't really stress the muscles. And it feels good. And especially if you're having some pain, stretching's been shown to help reduce pain. It kind of helps you feel better for, 20 or 30 minutes after you stretch. Generally, most people will feel better, after stretching just because of that effect it has on the body. So a cool down, I think it's important not only for your muscles, but I think mentally as well after a ride. I think it's good to just kind of take a moment to calm down, focus on yourself, and get ready to be able to focus and drive and be safe that way.
Very good. Very good. I think that's something that I need to do more of, is just more of a cool down, regimen there at the end of the rides. Because a lot of times we spend, in fact, I can't really think of any place that I go riding that is less than a 30-minute drive in the truck. And most of the time it's somewhere between an hour to 3 hour drive one way for a lot of the riding that I do. That's one misconception that I think a lot of people have, is that like, oh, Kyle lives right by all these places that you can ride. And that's true, but it's 1 to 3 hours. Sometimes we'll drive as much as 4 or 5 hours in a day one way to get to these trailheads that we're doing. And so warming up when we get there and then maybe cooling down at the end is going to pay dividends. I end up popping ibuprofen in the middle of my rides too, and when I'm done with the rides, just to kind of keep swelling down. I'm in pretty good shape, but I've just noticed that you're putting so much more stress on your body during these rides than you generally do during the day. Like my general day is sitting right here in front of the computer, editing videos, or maybe I'll do some filming or whatever, but I'm not crazy active on the days that I'm not riding, and I'm really only riding once a week, sometimes less. And so it's kind of a big, hit to your body. And I think that we underestimate how much stress we put on all the different parts of our body, whether it's, our core, our back, our necks, wrists, knees, and that type of thing. One of the issues that I have had recently in the last couple of years is with my sleep. Especially before a ride. I have a really hard time sleeping before a ride because I just am so excited about what we're going to do, or maybe I'm a little bit nervous about this thing or that thing, and that can play a big part in my preparation. What do you think nutrition and sleep, how do you think that affects us, and are there certain things that we can do or should be looking for in the days up to a ride on nutrition and sleep? What do you think on that?
Yeah, I think they're, kind of a disclaimer. I'm not a registered dietitian or anything like that. So, but just general good advice when it comes to sleep and nutrition. Sleep, make sure that, I mean, a lot of times if you're going on a long ride, you're waking up early, right? So that night before the ride, you're probably not going to get a lot of sleep because we all have lives. And, by the time you get the truck ready and everything else in your life taken care of, it's late and then you're waking up the next morning to head out. So if you can prepare ahead of time and make sure that, in at least a week, I'd say at the least, before that ride, you're getting, 7 to 8 hours of sleep, your body's just going to be a lot better able to manage the stress, the strain, and you're a lot less likely to have injuries just if you're sleeping better. And then nutrition, kind of going back to the sleep, how you're not going to get much sleep the night before. Nutrition, a lot of times, if you wake up, you don't have anything planned, you're stopping at Maverick or on your ride and you're getting something quick and probably not super healthy. So making sure that you're eating good, healthy food, you're not relying on junk food and high sugar and high carbohydrate things to fuel you for the ride. So all of that takes into account. It will benefit you and you'll feel better as you ride if you are sleeping well and you're eating well. And it's only going to serve to be your benefit. So just extra little things to keep in mind, and pack a couple of healthy snacks in the backpack, fruit and things like that really don't weigh a lot. And they're, bananas and apples don't take up a lot of room. They're just something that's pretty simple that has some good sugars in them that will help keep your energy levels up. Those are just easy things to add in to help you feel better while you're riding.
Yeah, no, that's very good advice. Maybe just one other thing, and thank you so much for taking so much time with us today. One other thing, let's talk about braces for just a little bit. I didn't wear really any braces for a long time. And then I tore my ACL while riding a trials bike, believe it, of all things. It was a 0 mile an hour injury where I just came down on it wrong and tore the ACL completely and the MCL partially. And from that time, I've ridden, after my ACL reconstruction, I've had braces. And I actually bought knee braces for both sides. I spent a bunch of money and bought knee braces for both of my knees. And I've been wearing those basically on every ride ever since. The very last ride I went on earlier this week, I decided maybe I wasn't going to wear the braces. So I didn't. I just wore some knee cap protectors. And then there's also neck braces out there. People can wear wrist braces and all sorts of different things. What is your, and again, obviously every person is a little bit different, but from your perspective as a physical therapist, as a doctor having studied these things and then doing it in practice, do you think braces are a good thing? Are they a bad thing? Or does it really depend on, the situation?
So the short answer is it depends. But general, like after an injury, braces can be a great thing. After ACL surgery, patients are in a brace for so many weeks, right? But then we progress them out of it. So for the lay public, I would say, if you've had an injury and your doctor's prescribed a brace, definitely wear it as prescribed for your doctor. But then a lot of the instructions for PTs is, our job is to kind of get people out of the brace and less reliant on it and resume their normal activities. You've got some professional athletes that they rehab well, and sometimes they'll still wear braces because their job depends on their health. And so that's just kind of an added safety measure. As a dirt bike rider, it's going to be up to you. And if you feel that as you ride, like if you've rehabbed from an injury and you've been cleared for activity and you feel safe and confident while you're riding, I don't know how necessary the brace is. If you feel that it gives you a feeling of comfort and you just feel more confident with it on, then great. It's not going to hurt you. So yes, they can be there. There are times when they're needed. Then after, you've rehabbed from the injury and you're back to normal activity, you don't always necessarily need the brace. But if it's kind of a comfort to you, I'm not going to argue with someone and say, well, you should just not use it at all. That's going to be very individually based. But if you haven't had an injury, I think it depends on the type of riding you're doing. Obviously, younger kids in motocross, yeah, if they're my kids, I'm probably going to give them a neck brace and all those things. and that's obviously an individual and sometimes a family decision as to what you feel is safe and smart for you and your family member. But if you're out there on the trails riding, cover the basics first. Really good helmet, goggles, gloves, and boots. Beyond that point, I don't know how necessary a brace really is. You could talk to your doctor or a therapist or someone about that if you have a concern. But definitely don't feel like you've got to go out and buy. If you haven't had an injury, don't feel like you've got to go out and buy all these different braces and supports before you go ride. Just think about your needs. If you've had any medical issues in the past, consider those. And if you have any questions, consult your physician or consult a PT and make an individual plan. So,
yeah.
Broad statement is it depends, and there's all these factors that go into place that kind of determine on whether it's right or not for you.
Yeah, and it's really interesting because for me with the knee, I feel like the knee that was reconstructed and subsequently rehabbed, I feel generally that it's probably a stronger joint than the other side. My leg size has never actually fully recovered, because there was some muscle atrophy, and because I don't have a gym membership and I'm not trying to build my leg back up as far as its size, but it's just as strong as it used to be, probably stronger. And I just got thinking about it this last week, and I'm like, you know what, I'm going to just take the brace off after, this one ride. And so it'll be kind of an individual decision, but I don't think that in my riding, I'm not using it as a crutch. I don't feel like, it's giving me any sort of touchy-feelies, and it's not giving me any sort of extra confidence. I never even think about the braces when I'm riding, as far as on the knees. And so those, I may just slowly transition off wearing them. But as far as neck braces go, it seems like that's a really polarizing subject. I talk to, every once in a while, I'll go to a chiropractor if I've got something weird going on. And the chiropractor I go to actually is a dirt biker as well. And he is like, I don't really think your neck braces are going to do much for you. He doesn't have a strong feeling one way or the other, but he also is concerned that, hey, he's like, look, the injuries and things that I see people getting and I'm working with people on, I don't think those are actually helped by the neck braces. And so he is a dirt biker and he doesn't wear one, and he's a chiropractor. So it's one of those things where it seems like there isn't really any great science on one side or the other. You can find arguments both ways, and it's just kind of split down the middle, it feels like, on neck braces. Is that kind of in congruence with what you have seen, or do you have a feeling one way or another with neck braces?
I agree 100% with that. I think it's individual based. That's a decision that you have to make as an individual. What do you consider important? What are you, a lot of times some of that's financial too. I mean, all this stuff can be expensive. So what are you going to spend your money on first? What safety equipment do you prioritize first? So yeah, as a physical therapist, I would probably never directly tell someone, no, you shouldn't, or, if they've had an injury, there's a high likelihood I'm going to say, yes, you should. If they've had an injury, right, depending on what it is. But I don't think I'd ever tell someone, no, you don't, not to buy it or not to do it. I think it's an extremely individual base. Just I would give them education on their injury, education on as much as I could, right? And I think my part is more of an educational piece. Educate the patient, educate the client, and then let them choose. Because if you give the education and then they make the decision based off the education that they seek out, whether that's from a PT, a chiropractor, a trainer, another dirt biker, I think all of us feel more comfortable and with our decisions. If we're the ones that make it and someone didn't just tell us to do it, but if we make that decision based off solid education.
Yeah. Well, this has been fantastic. Thank you so much. It's Dr. Jacob Kapp here. We've been chatting about physical therapy and some different types of exercises we can do, and mobility in our hips and our neck and our back, and a lot of cool stuff. Thank you so much. If people want to get in touch with you, or if they have questions about your practice, is there a good place for them to kind of get that information?
Yeah, so they can email me I can send you my business email, and then if you want to put that in the notes or anything. Yeah. But so they can email me at mountainstrongspine@gmail.com. If there happens to be any law enforcement listening to this and they're they have questions or concerns as well, then I direct them to the other company I work with, which is Extremis Performance. And the email for that is jlabhart@inextremis.us. And I'll send you both those emails, Kyle, and we can put those in the notes if anyone's more curious. But
send me those.
Questions or concerns, feel free to reach out.
Perfect. Send me those today because I want to try to get this podcast out. It's been a while since I've dropped one, so it was on my list of get this thing recorded and then get it produced and get it out there. So I look forward to getting those emails from you. But again, thank you so much, and I just appreciate you coming on.
Yeah, thanks for having me. This was great. It's a lot of fun.
All right. Okay, thanks. Have a good day.
Yeah, you as well.
Bye.
Bye.
And that is our podcast there with Dr. Jacob Kapp. So I just want to thank him for coming on. That was really, really gracious of him. We talked about some pretty cool stuff. And I'm going to, it's all about the more we know. The more we know, I'm going to start changing the way that I look at, especially even just preparing for these rides and the warm-ups and the cool downs. And I'm going to start to think more about my mobility in my hips and see if I am lacking in those areas and look into some other things that I can do to try to gain a little bit more mobility there. So I'm pretty excited about that. If you guys want to support this podcast, one of the best ways to do that is to use the links that I have in the show notes or even in any of the videos that you see online. There's links to Rocky Mountain ATV, Motorsport, and Amazon. Those links help to support the podcast and to keep these things going. So that's what I have for you guys today. If you have other ideas for podcast topics, you can always email those to me. It's kyle@dirtbikechannel.com. That's how you can get in touch with me. And I'm sorry that I haven't put out a ton of these podcasts recently. It's just summer's a crazy time with my family. So this was a good time to get back on the horse and get another podcast in the can and produced. So I really appreciate you guys listening. Please subscribe. Please share these things with your friends. And until next time, let's leave a single track. Thanks.